This is Expert Medical Academy, where hard concepts are made easy peasy. We are continuing with introductory lectures in embryology, and we shall talk about the female reproductive system today, where we shall crack and demystify facts about the ovulation and the ovary. I'm Oscar A. Matthews, your usual captain. Let's get right into these things. The female reproductive system, like the male reproductive system, has a primary organ and secondary organs. So the primary reproductive organ in the female is actually the ovary, and the secondary reproductive organs in the female include the uterine tubes or the fallopian tubes, the uterus, the vagina, the vulva, and the vestibular glands. The female genital tract consists of the fallopian tube, the uterus, and the vagina. And this tract provides the site for fertilization and site for the development of the embryo. This illustration shows the organs of the female reproductive system. We have the fallopian tube with its different parts as shown. We have the uterus with also its different parts, and then we have the vagina. So the fallopian tube has the intramural part, which is embedded inside the uterus. It has the isthmus. It has the ampulla where fertilization occurs. It has the infundibulum, and then the fimbria of the uterine tubes, some of which are in contact with the primary reproductive organ in the female, that's the ovary, specifically during the time of ovulation. The ovary is connected or anchored to the uterine wall by the round ligament, and the uterus has the uterine cavity and its uterine wall with different layers as seen. It has the endometrium, it has the myometrium, and then the perimetrium, and continues as the cervix. So we can see the cervix with its cervical opening here. This is the internal os or the internal cervical opening, and then this is the external cervical opening that opens into the vagina. It's also called the external os. We have the vagina and the fornix of the vagina. The uterus is partitioned into three parts as the fundus, the body, and then the cervical part of the uterus. The ovaries, however, are small ovoid organs about 3 centimeters long, 2 centimeters wide, and 1 centimeter thick, and they are located in the lateral wall of the lesser pelvis on each side of the uterus. They are also positioned below and behind the uterine tubes, and each of them is connected to the upper part of the uterus by the round ligament, as we saw earlier. And one end of the ovary is in contact with the fimbria of the uterine tube. And during ovulation, sex hormones activate the fimbria, and they attach to the walls of the ovary, sweeping on it to suck and grasp the released ovum from the ovary. The ovary consists of a thick outer cortex that surrounds an inner vascular medulla, and the cortex is made up of a connective tissue covered by the germinal epithelium. So germinal epithelium covers the cortex, and the cortex has follicles in different stages of maturation or development, and cortical transplant can be done to treat cases of infertility. And then the medulla, we said, is the inner vascular layer having blood vessels and lymphatics that drain and supply the ovary. So the ovary is responsible for production of the ovum. Before puberty, primordial follicles are present in the ovary, and these primordial follicles develop in the early stages of intrauterine life up to around 20 weeks. So 1 to 2 million in number of primordial follicles are present in a female by the time of birth. Then after puberty, ovarian follicles in various stages of maturity are present, each containing an ovum. But before that, the ovaries are actually in an active state. And during the childbearing age of a female, only one ovarian follicle matures and ruptures, releasing an ovum into the peritoneal cavity that is eventually grasped by the fallopian tube with the help of the fimbria. And this process of release of ovum from the ovary is known as ovulation, and it occurs periodically throughout the reproductive life of a female in what is termed as the ovarian cycle. But when a female is past the reproductive years, that is about 40 to 50 years, the store of ovarian follicles eventually diminishes and the reproductive capacity of the woman ceases, a time called the menopause. Also, pregnancy temporarily suspends the ovarian cycle. This illustration shows the ovary containing follicles at different stages of development. So we can see the primary follicle is here, and it eventually matures and ruptures to release the ovum, leaving behind the corpus luteum that degenerates to form the corpus albicans. Then when we talk about the ovarian cycle, it is a cyclic release of the ovum from the ovary, and it's controlled by hormones that are secreted by the pituitary gland, specifically the anterior pituitary gland. So at the onset of puberty, the pituitary gland secretes the hormone follicle stimulating hormone, and under the influence of this hormone, the primordial follicles in the ovary start growing, and the growing or maturing follicles produce the hormone estrogen. And the role of this hormone is preparation of the endometrium wall for pregnancy. However, among the developing follicles, only one reaches full development and is called the Graafian follicle. An increased level of the hormone estrogen inhibits the secretion of follicle stimulating hormone from the anterior pituitary gland via negative feedback, reducing the pituitary release of follicle stimulating hormone. The pituitary gland not only releases follicle stimulating hormone but also luteinizing hormone, which influences the Graafian follicle to burst in a process termed as ovulation. And the ovum is released from the Graafian follicle due to action of proteolytic enzymes formed by the thicker external cells that cause dissolution of the capsular wall of the Graafian follicle. So proteolytic enzymes like plasmin, metalloproteinases, and collagenases cause the Graafian follicle walls to weaken and rupture to release the ovum. And also plasma transudation within the follicles causes it to swell and also increase the pressure within the follicle. An increased intrafollicular pressure with simultaneous dissolution of the follicular capsular wall lead to the follicle to rupture and release the ovum. Then when ovulation takes place, the empty Graafian follicle develops into the corpus luteum that secretes the hormone progesterone. And the corpus luteum degenerates after 10 days if the ovum is not fertilized. So when this happens, there will be decrease in the level of the hormone progesterone, which triggers the pituitary gland to start secreting follicle stimulating hormone to initiate a new ovarian cycle. So the cyclic changes in the ovary include the development of ovarian follicles, ovulation, and formation of corpus luteum, constituting the ovarian cycle. The corpus luteum persists for 2 to 3 months if the ovum is fertilized. By that time, the placenta develops and starts secreting the hormone progesterone and estrogen. And high levels of these two hormones in the blood suspend the ovarian cycle during pregnancy. The ovarian cycle basically has two phases, the follicular phase and the luteal phase. The follicular phase corresponds to the first half of the menstrual cycle, and during this phase, follicles develop and discharge one mature oocyte into the fallopian tube. And changes in the endometrial wall of the uterus during this phase occur due to secretion of the hormone estrogen by the developing follicles. Then the luteal phase corresponds to the second half of the menstrual cycle, and formation of corpus luteum occurs during this phase after ovulation, and changes in the endometrial wall of the uterus during this phase take place due to the hormone progesterone. Here is a demonstration of the ovarian cycle. We have the pituitary gland having its posterior division and then the anterior division called the adenohypophysis. The posterior division is also called the neurohypophysis. And the anterior pituitary gland secretes the hormones, follicle stimulating hormone and luteinizing hormone, which go on to control all the phases of the ovarian cycle as discussed earlier. Please like, share, and subscribe. We need the family to grow.